Luminaire Institute presents
Honorable scholars, respected doctors, my dear friends, on behalf of Luminaire Institute, I greet you all with the Islamic greeting, Assalamu alaikum wa rahmatullahi wa barakatuh. Science and religion, spirituality and medicine. To most people, this is an oxymoron. You might think that if you take a spectrum, there's two extremes. There's religion and there's science. But a little bit of in-depth study and a little bit of research will tell you that the two, science and religion, they go hand in hand. Spirituality and medicine, they go hand in hand. Religion talks about prevention of illnesses. It talks about cures for diseases. It talks about healthy eating habits, healthy living habits. Science, on the other hand, has given us so many solutions to our sicknesses. Science has taught us healthy habits. Science has taught us how to cure our sicknesses. Today at Health Matters, Luminaire Institute aims to bring the two together and show you what amazing similarities these two have. You take religion, there are volumes and volumes of prophetic medicinal books. And you take science, I don't even want to go into that because we've all visited doctors, we've all seen the vast world of science that exists out there. So today, just to remind you again, here at Health Matters, we're here to bring the two together. So in case you are wondering, you're here with questions, what is this event about? Health Matters? Why is a scholar talking about health matters? And what is a doctor doing in a religious gathering? Well, that's what we're here for. So, inshallah, today's idea is to get a medicinal perspective from Dr. Kamaldeen. Inshallah, we'll talk about him in a while. And of course, a spiritual perspective from Sheikh Mu'izz Bukhari, who is here. So, inshallah, without further ado, like I said, inshallah, we will begin with the recitation of the Quran. And none other than our very own Sheikh Mu'izz Bukhari will be up here on stage to recite to us a few verses in order to attain the blessings of Allah subhanahu wa ta'ala. Sheikh, it's all to you.
Assalamu alaikum wa rahmatullahi wa barakatuh. No, I'm not happy with that at all. I need to see some energy and vibrance. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullah khair. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام فيها فاكهة والنخل ذات الأكمام والحب ذو العصف والريحان فبأي آلاء ربكما تكذبان خلق الإنسان من صلصال اسمك الفخار وخلق الجان من مارج من نار فبأي آلاء ربكما تكذبان رب المشرقين ورب المغربين فبأي آلاء ربكما تكذبان مرج البحرين يلتقيان بينهما برزخ لا يبغيان فبأي آلاء ربكما تكذبان فبأي آلاء ربكما تكذبان يخرج منهما اللؤلؤ والمرجان فبأي آلاء ربكما تكذبان وله الجوار المنشآت في البحر كالأعلام فبأي آلاء ربكما تكذبان فبأي آلاء ربكما تكذبان كل من عليها فان كل من عليها فان كل من عليها فان ويبقى وجه ربك ذو الجلال والإكرام كل من عليها فان ويبقى وجه ربك ذو الجلال والإكرام جزاكم الله خير.
Jazakumullah khair, our very own Sheikh Mu'iz Bukhari. Thank you very much for that breathtaking recitation of Surah Rahman. Right then, let's get right into the evening's program. I cannot but wait to mention and thank someone very special who is here today. And I think having him here really lights up the evening. It's really an honor on behalf of Lumina Institute that we have Dr. Kamaldeen here. I think most of us don't really need introduction for Dr. Kamaldeen, but anyway, for formality's sake, we'll just mention that Professor Kamaldeen is a specialist intestinal surgeon and counts an experience of 30 years. After graduating from the Peradeniya Medical School, he worked for over 12 years in the United Kingdom and the USA before he returned home with his family to serve our nation. He was a senior professor and chairman in surgery at the University of Kelaniya Medical School before he took early retirement in 2014. Professor Kamaldeen is a visiting professor at universities at home and abroad. He has delivered over 400 talks across the world and is ranked by Google Scholar among the top 20 scientists in Sri Lanka. He has a special interest in the human intestinal tract and has many publications regarding its research. So once again, we are absolutely honored and privileged that Dr. Kamaldeen agreed, first of all, to be part of this evening, and the fact that he actually made it to enlighten us and give us an idea, a medicinal perspective to mental and physical health. So without further ado, I'm sure most of us here are waiting to hear from him. We invite Dr. Kamaldeen to take the stage. Thank you very much.
Assalamu alaikum. Thank you very much, Sheikh Mu'iz Bukhari. I hadn't known you from then, but I now know you. I've heard you at the Juma talks, and again, I tell you, They're most impressive and keep up the good work. This is indeed a step in the right direction. I think Muslims are known to be leaders. We are leading in the right direction in this country at least, and what better can you do than to ask people of all faiths to attend? Because health deals with mankind, not with a community. And if health is for mankind, then this talk is for all of those faiths. We are indeed, in the medical profession, extremely grateful to Allah for having brought us in. There are colleagues here, and what better way can we live our lives on this earth than serve the sick? And it is said in the Quran, as you know, that if you save a life, it's like saving the whole world. And we get to do this day in, day out in our lifetimes. I'm grateful to my wife and my family for having coped with long hours that we and also my other colleagues in the profession spend out of hospitals, in the wards, and away from our homes. I think you don't have to understand too much, but let me tell you that being a spouse of a busy surgeon or a doctor like I am and any of my colleagues are is not an easy task. And most people who bless us at the end of the talk and at the end of all of what we do, bless our wives more than we bless ourselves, our patients. And I've always wondered why, until my wife told me why. So let me start by talking to you, giving you a perspective of what the world is today compared to what it was when I myself was in school. There was a patient of mine who was 70 years old. He worked as a roadworks engineer, and when I meet people of that age, I ask them what the world was in their working lives. And he says, "Doctor, you know, this was an amazing country to live in. It isn't, and the world isn't anymore, because when I got my first posting as a roadworks engineer, I was posted to deep in the south, and they asked me to do this stretch of road. So I surveyed the place. I spent a week doing the survey and sent it up by mail up to Colombo. I knew Colombo was not going to respond to me in the next 2 weeks. So I took my family and we went camping across the whole of the country. And when I was back in time after my camping holiday, mind you, he's at work, I was back in time, the order comes to start the work on the road. That was how life was then. Now it's different, and I think I'd like you to think about the use of the cell phone. The cell phone has changed everything that we do in our lives. People are now geared to instants in everything. They want instant food, instant fixes, instant medicine, so much so that when people, I'm an intestinal surgeon, when people come in to see me and ask me how long the recovery period would be for a removal of part of a cancer and then joining up, I'd say you'd probably be spending 7 days in hospital, and that's not good enough for them. They want to get out of hospital quicker. So this is instant surgery, but I warn you, we cannot change, because health and medicine, it cannot change like the world does. And if we doctors do change, then we are going to miss out somewhere. Somebody's going to suffer from errors. And that is the problem that medicine has with the world today. The corporate world has changed. They fix people's requirements, they fix it instantly, but we cannot do that in medicine because health has not changed. And the importance of health, obviously, to get back onto my talk, cannot be overemphasized than this statement here, where Abu Darda once said about the Prophet ﷺ. He was visiting a sick patient on his bedside, and the patient asked the Prophet ﷺ, "O Prophet of God, if I'm cured of my sickness and I'm thankful for it, is it better than if I was sick and bore it patiently?" And Rasulullah said, "Verily the Prophet of God loves sound health, just as you do." So that alone emphasizes the importance of health in Islam. And in any religion, because all religions essentially teach the same thing. We live in Sri Lanka, and if you look at what a great man, the Buddha, has said about health, He goes on to say, the Sanskrit word for that is Arogya Paramalabha, which means health is the greatest gift, may I add, to mankind. So health is at the center of our lives, it's at the core of our lives, and we need to watch over our health because there's something terrible happening to this part of the world and the whole of the world in terms of health. And I'm going to touch basically on the health of children that we see today. I'm going to touch on the health of our eating habits because I will tell you and show you in a minute the top 10 causes of death in Sri Lanka. And these are pretty much the top 10 causes of death in the world. And about 1/4 of these deaths can be prevented, 1/4 of these illnesses can be prevented by how you watch your eating habits. And that's all I'm going to focus on. Sri Lanka is different from South Asia. That means Bangladesh, Pakistan, India, in our health statistics. Whenever we have visiting people from abroad come over here from the West, they're absolutely amazed at our disease patterns, at the way our people are literate and come up for prevention rather than cure. And that essentially reflects in the red square there, where if you were born in 2015, on average, a woman would be expected, or a baby girl would be expected to live 80 years of a whole lifespan. If you were a boy, you'd be expecting to live around 73. And that's not different from the West. So our people are living longer. But as we live longer, we have to understand that we are dealing with an elderly population that we all know follows the cycle of life, and therefore they're going to be ailed, and we need a great younger population to take care of these people. These pictures are what are called population pyramids in scientific terms. And on the left-hand side, you see a pyramid, because that's about the time that I was born in 1960, and what's in the square are the number of elderly people that lived or were expected to live, and that's very small. I got to see only 2 of my 4 grandparents, but now pretty much any one of you younger people in the audience will probably be seeing all of your grandparents for most of your schooling ages. And so that's how Sri Lanka has changed. As I was young because, and I was fortunate in a way, in a nasty way, because I would get pocket money from my older grandparents, but wouldn't be around, they wouldn't be around for me to take care of them. But you, younger people, will be having our pocket money as well, but you would also have a great burden on yourselves having to take care of your grandparents. And that's the essence of it. What you're seeing here on your right screen is not a pyramid anymore, it is a barrel, because the number of older people living in our part of the world is getting greater and greater, and that's not different from the West. The top 10 causes of death in Sri Lanka. Look at that. Ischemic heart disease, in common parlance, is called heart attacks. Strokes are brain attacks, and diabetes. These are the top 3 killers of all causes of death. And may I remind you that all of these are caused by improper eating habits, aside from everything else. If you look at the bottom there, you see cirrhosis of the liver. And in cirrhosis of the liver, most of us would understand that cirrhosis is a degenerative condition of the liver that is caused, as we all know, from historic times, by abuse of alcohol. And alhamdulillah, most of us do not take that, and in fact, all of us don't take that. But yet I will show you how even without the abuse of alcohol, you can die from cirrhosis. And that is the huge problem that we face, all because of lack of care for our eating habits. This is the root cause. Fast foods, instant fixes. Most parents who come present their children with tummy pains and aches that get diagnosed as various things, eventually we find out do not have time to take care of their younger children before they go to school. So what do you give them? Doctor, I give these kids a pastry or short eats for breakfast, because that's what they want. Now, I think we have to realize that children are here on this world, on this earth, to be taken care of by older role models. And if our parents and us don't behave as role models, you cannot give in to children's wants in the way that is detrimental to their health, because when they get their cirrhosis, we won't be around in this world anymore to take care of them. And that is where responsibility and accountability comprise. So if you are a Muslim living your life, I think the number one thing in this world, whatever you do, whether you're in medicine or whether you're in business, or indeed whether you're a parent, is be accountable, because that is the one word that I will describe how you need to live your lives. And just like that, I think fast foods taken in inappropriate amounts, taken at breakfast time, is pure lack of accountability of parents on behalf of their children. So I think this is the root cause, and I'll tell you why, and we can discuss why at the end. Because consumption of fast foods produces overweight and a condition called obesity. If you know anything that is called the body mass index, which is a description of how big you are based on your height and your weight, a body mass index of over 25 means you're overweight, and if you have a body mass index of over 30, it means you're obese. And this was a map from 2008 of the number of obese and overweight children across the world. All of those shaded areas, if you look at the orange shades, the whole of North America has more than 25% of their children who are overweight. Look at Australia, the whole of Australia has 25% of children who are overweight. Lots of the Middle East, Saudi Arabia, Lebanon, other parts of Middle East, also same as America. India has a similar number of boys or girls who are overweight. And if you think that girls are the only people who are overweight, look at the young boys. 20% in 2008, 20% of children boys under 15 years in India were overweight. Almost all of America's 25% are extremely overweight. And this is our future generation. This is the future of the people who are going to run our world. It's not looking good at all. We are sitting on a time bomb waiting to happen. And I think this is where we need to take the bull by its horns and turn this around. And this is exactly the reason why we're here today. This is the first of these talks, and I'm sure the Luminia Institute will have more of these talks in which we can go home and reflect on what we talk today, and you as parents and the young children who are here listening to these talks will actually make a step forward to change the way you live your lives, because everything that can be done for your bodies can be done through proper eating habits. Dr. Muhammad, who works at the Wayamba University, wrote a review article on obesity. And the publication is right up there. You can go on Google and check it out, and you can find out a lot of the reasons why he's written this article. But at the bottom, if you crystallize the essence of his article, he has pointed out the reasons for why childhood obesity is prevalent. And of course, always, the parents are blamed. Number one, genetics. But it pays to understand that although there are people who are genetically susceptible and everything can be explained genetically, and that is why religion and Islam, or whatever religion, is so close to medicine, is because in religion it's all laid down. We know that there is a genetic susceptibility to anything. It is in science we don't know enough. And the whole thing with researchers like us is we are trying to bridge this gap between what Allah has laid down for us and what we don't know. That is the thing about researchers. So genetics is laid down, but genetic things do not happen, they do not manifest until the environment is in the right stage. So a child may be prone genetically to be overweight, but if you don't put the fast food on the table, this child is not going to be overweight. You can change the environment. The genetics, forget about it, but it's there. Snacking on fast foods, yet another cause for childhood obesity. Skipping breakfast, and I'll tell you why. Reduced physical activity, a sedentary lifestyle like most of our children these days. All they do is come back home, get on Xbox and screen viewing. and reduce sleep hours. If you ever try to get on Google on the internet at nighttime, 2 o'clock in the morning, it'll be busy. You can't get into the net sometimes. But if you get on it daytime, you get in within seconds. And the reason is because there are a number of young children and adults awake at nighttime. They're always on the net. And this reduces their sleep hours. Very soon, in about 20 years, if you think about environment and genetics, man might be born with different characteristics. We may be born with daytime blindness because most of us will be nocturnal creatures like bats. And that is what evolution will do for us. So remember that we are creating trouble for ourselves and for our future generations by making sure that these things persist. And it's all driven by commercialism, I have to say. Commerce will do anything without accountability, just like television does, for their benefit. I think it's important for us responsible people to grab this by the horn and say we're going to change the way our communities deal with life. If you thought only that Sri Lankan children were prone to obesity, look at this paper from Dr. Katulanda and Professor Sherif's unit in the medicine medical faculty in Colombo. And what they're saying is that people who are overweight, of adults surveyed, and they surveyed about 5,000 adults, about 1/4 of them were overweight. Another quarter had a lot of central obesity. And now, what is central obesity? That is central obesity. And this is where you see a lot of fat around the belly area. Now, this has been a problem in Asian countries because previously, during the times of malnourishment, it was rare to see somebody who was well-made and fat and big-made. And so a lot of men, even now, the younger men in the villages, think it is a sign of prosperity to have a belly that is protuberant. And that creates a cultural problem for people in our part of the world. And I think we need to teach them and advocate for non-obese bellies. And if you can do that, then we are also in the step in the right direction. Because if you see somebody with this kind of belly, what you know for sure is that this person has got fat buildup around the liver. They've got cholesterol buildup around the hearts of the blood vessels, or blood vessels of the heart. And everywhere you can get a blood vessel, it gets furred up with cholesterol deposits, and thereby these people will eventually die of heart attacks, or even if not die, they will be affected by heart attacks or strokes. That is why we are number 1, 2, and 3 are fat-associated disorders. The consequences of obesity, now called the metabolic syndrome, are high blood pressure. So if you have somebody with hypertension or high blood pressure, the first thing to do is reduce weight. Get on medication, yes, but reduce weight and get that exercise going. Because your weight is a result of the amount of food you eat versus the energy you expend. Adult onset diabetes is a significant risk of those people who are obese and overweight. Heart disease, cancers of the breast and bowel are prevalent more in overweight people than non-overweight people. And most overweight people, those of us who know overweight people, have sleep disorders. They cannot sleep for long periods of time because they get what the condition called sleep apnea that makes them keep awake at nighttime and they fall asleep during the daytime. So their efficiency and work productivity is significantly reduced as a result of the consequences of being overweight. So these are the WHO recommendations for obesity. You'd probably understand as you read that these follow some of the sunnah that we are aware of. If you are a young mother and deliver a baby, feed that baby within the first hour. Because if you do that, breastfeed that baby, you have immediately started the process by which you may prevent this child from being overweight. The other World Health Organization recommendation is to exclusively breastfeed your baby for 6 months. Nothing else, just breastfeed for 6 months. Reduces obesity in later years. And continue to feed for up to 2 years. That's what the Prophet recommended. And that's exactly what the WHO is telling us now. So there is very little, if you see this mystique between religion, Islam in this situation, and medicine and science, I think this is man-created. We don't have to create this divide. We're all in there. We understand what we're doing. But it's the mystique that science does not mix with religion that creates this problem in our minds. I personally have no problem. How can school children prevent being overweight? Well, limit your energy intake from total fats and sugars. Give them more protein is the bottom line. Lots of fruit and vegetables is the other one. And engage in regular physical activity. The recommended time limit for physical activity is 60 minutes a day for children. And I think that's a good bit of advice. Right. So if you can do that, and reduce the way in which we consume our fats, and we are conscious about what we do, then certainly we can reduce the first 3 killers in our land, and that is, of course, heart disease, stroke, and diabetes. But let me talk to you a little bit about cirrhosis of the liver. Now, cirrhosis of the liver is a condition where the liver, which is a factory of our bodies and the number one factory in our body that has over 500 functions that you and I take for granted. And the data from a recent study in Sri Lanka about diabetes, the study actually was done by a specialist physician called Janaka Karaliyadde, who works at the King's College Hospital in London. He's a Sri Lankan working with our Diabetic Institute, found that over 25% of people, adult children, people, are predisposed to diabetes. And the fact that we have such a high prevalence in children has not been shown in Sri Lanka before or anywhere else in South Asia. And so it is of great concern. Now I'm going to take you on a trip that I was 2 weeks ago. 3 o'clock in the morning, I got a call out from the local hospital saying we have a 60-year-old woman who's vomiting blood. And I said, how long has this been for? And the doctor on the other side of the phone at the emergency room says, she's been vomiting for 4 hours, her blood pressure is down. If she continues, she'll be a goner. So we had to come in, put in lots of intravenous infusions, get her what we call resuscitated, get her blood pressure up. And then the first thing, of course, if you're vomiting from the intestinal tract, we have wonderful instruments called endoscopes these days that we can put down the intestinal tract and find out where you're bleeding from. Simple. But when we did that, actually, we found that she had this condition called varices in the gullet. Varices in the gullet are like earthworms or blood vessels found that have ruptured in the gullet. And the first time you see that, you know that she's got cirrhosis. What's her name? Let's call it Fatima. She was a Muslim. Cannot be alcohol, can it? Most of our Muslim women don't drink. So I said, what's the cause of this? She went on to find out that she had diabetes. The diabetes was not in good control. She had poorly controlled diabetes for the last 5 years. Nobody cared about her, neither did she. Her liver went on to being a normal liver from the left-hand side to what we call a fatty liver, which you obviously see full of laden with fat, and that's exactly what you have. When you have a fatty liver, that progressed to produce cirrhosis. So if you had the idea that alcohol alone was the cause of cirrhosis in our part of the world, you can easily take that out, and it can tell you that there are other 2 major killers of the liver, and that is diabetes and being overweight. So don't shoot your liver down, because if you shoot your liver down, you pretty much got rid of your factory that manages most of your health and nutrition. It's important that you preserve your liver to the best of its ability. So, in my mind, if you ask the question, is there a difference between a person who abuses alcohol and one who abuses food? In my mind, absolutely no difference, because the person who abuses alcohol is also abusing his body, and the person who abuses the use of food, which was meant for consumption to perform our daily activities, is also an abuser that can result with the same fate. And so the bottom line of this is to be able to consume and eat sensibly so that we can add what we call life to years, not years to life. There's no point living to 80 years of life if your quality is going to be poor. Now, with that said, I'm just going to take you through some slides in the next few slides about how we can actually get better control of how you eat and prevent obesity. We have this wonderful oral cavity, or the mouth, because the mouth is meant to sample the food you eat, and that means taste the wonderful things that have been created for us in this world. And food is beautiful to eat and wonderful to eat. But it also does another thing, and it is what God gave us, what we call a grinder and a blender. And it's important that you chew every bit of food you eat, because once it goes down into your gullet, then it's not going to be chewed anymore. And therefore, I think it's important at this point that we think about mindfulness in eating. In other words, if you're eating with mindfulness, then you're probably going to eat the burger on the left-hand side in 5 minutes. But mindless eater will eat 2 burgers in 5 minutes. Think about why you eat. You're eating to keep that food right in the back in your mouth, and beyond that, you don't have the taste of any food at all. And so you sensed pleasure of eating. The one on the left-hand side has sensed that pleasure with 1 burger, compared with the other person who eats fast and mindlessly, sensing the pleasure of 2 burgers. Now, you obviously know the number of calories this person is going to pack in purely because of mindless eating. So I think it's important. All of this is Islamic, and the Sheikh will tell you all about it if you do ask him, to be focused on why you eat. Sit down, think about what you're going to do, and eat. Don't just snack. Well, you thought this was science until now, but previously, many years ago, more than 1400 years ago, great people told us about mindful eating. But now at the Harvard Institute of Mindfulness and Medicine, we know that if you eat mindfully, you can help with weight loss. Yet another slide that talks about control of our eating habits. And so now once you chewed your food up and you swallowed, then you come across this area marked by the cross, the X, which is the junction between the swallowing tube and the stomach. And that stays closed because there is acid filling up that stomach, and if the acid escapes and goes up into the gullet, it causes this condition called reflux or heartburn or gastritis in most cases. Now that junction of the gate control at that point labeled X will only open once every 7 to 10 seconds. So you can eat as fast as you want, but that will open up only once every 7 to 10 seconds. Some people who eat fast have about 3 boluses of food lining up like a traffic jam waiting to enter the stomach. And that's not good, because over a period of time, this gate, X, opens up and gives up. It says, I'm going to stay open, you can eat as fast as you want, and I have no control over you. That's when people start getting acid reflux and burps. And herein, I'd like to make the point that us older people and parents are role models. Because when I was a young child, and those were the days when our communities ate in sahans, and I used to watch the older people eat around the sahan. There'd be about 5 men around the sahan eating, and it looked to me as if it was one huge big competitive eating match. Nobody would give in to the other. They're eating as fast as possible, and there was me, this young child, and I'm serious, thinking, okay, this is the way we should be eating. Why am I eating so slow? You see, so I think as elderly people, as elders and parents, just the way we behave and the example of how we behave can impact hugely on a young child who you don't even know. So I think it's important to understand that you are a role model in the way you live your life. As long as people are watching you, then you will have an impact on them. So what happens is once the food gets in there, let's say you have a large piece of food that has not been bitten, not chewed up, entering the stomach, and then what happens in the stomach? The stomach will digest the food and not actually send it down beyond into the area called the duodenum, which is the small intestine, because the food is large, the particles are large. And a large particle going through the stomach into the intestine will block off the intestine because the intestinal tract is so narrow. And these patients will present with bowel obstruction that requires surgery. The stomach has an additional function of protecting the rest of the intestinal tract. And watch what happens. If you have a small particle, it goes through. But if your chewed up particle was not small enough, and it's big, like the one that is left behind, then it goes and gets held back. And so food is going to be retained in your stomach for longer, which is unhealthy if you do not chew your food well. So simple number one rule is just sit down, spend time, chew your food well. Swallow once every 7 seconds. This is all we tell our patients. Spend about 20 minutes to complete a meal. And these data have been shown to be positively effective from the Harvard Institute of Medicine. The proportion of food and drink we eat, again, has been talked to us many, many years ago. I think when you eat, you should not eat to fill your chest cavity as you sometimes do. 1/3 of it should be food. We all know this. 1/3 should be water, liquid, and the other third empty. Because as food enters the stomach, the process of digestion begins. And one of the byproducts of digestion is gas. And we need some space for that gas. If you don't have space for this gas, that is the feeling that you get that food is right up in your throat, then the gas that is produced, and it will be produced because digestion starts off, will break through your sphincter and come up here into your oral cavity and sometimes into your nasal passages and produce a number of conditions from sinusitis to infections in your ear and a number of things like even asthma because it can go down the gullet. So I think it's important that we understand that we follow the sunnah in the way we eat. And if you are so hungry, then it's okay to eat once every 3 or 4 hours rather than fill your stomach up and think you're done for the rest of the day. You all heard of the story that when you eat and when you lie back in bed, you should be lying on your right side. Haven't we all heard that story? And here's the science behind it. If you lie on your right side, what happens is the small intestine is now positioned like in the picture on your right side. And if you have a particle of food, it goes through based on gravity because you're asleep now. And the stomach stops working because once you go to sleep, your central switchboard goes off to sleep and the food just empties out by gravity. And so if you've got a little bit of food remaining, then that goes down the right passage. But if you sleep on your left-hand side, then look what happens. The food has to climb uphill and go, and that's never going to happen because the forces of gravity will keep it back in the stomach. Instead, it tends to go up the gullet. And that is why sometimes after a heavy meal, especially if you have not waited for 3 hours for the meal to empty, you wake up at about 2 o'clock in the morning with effects of heartburn, purely because of the way you eat and drink, and purely because of not waiting for long enough after a meal and assume the wrong posture when you sleep. Simple but very effective things. You don't need rocket science to tell you this. I've just shown you this in a diagram. So food for thought, ladies and gentlemen. I think parents and adults are role models. We should be conscious of what we do, I think, and be accountable to yourself first and to everybody else. I think the story about Doc, I don't have time, is not an excuse. Because you have time for things you want to do, things that are pleasurable to you. And so I think it's important to understand that just sitting down, eating at breakfast time, spending time with your children is wonderful time for the kids to develop and grow, and you have served your purpose as a role model right from day one. Have breakfast as a king, dinner as a pauper would. And the common thing that I tell people who understand less is that if you're on a long trip from perhaps Colombo to Jaffna, you would choose to fill your petrol tank in at the start of your journey, not after you finished your journey back in Jaffna. And there's no purpose of that. So like in the same way, your journey for the day starts in the morning after prayers. So have breakfast is the main meal of your day. At dinner time, you don't need any food unless you're a special forces soldier on a special operation at night time. So you should be eating very little. If you do not eat little and you fill yourself, an occasional biryani is fine, but biryani time in, time out, at night time, fills your stomach, and the body and nature does not waste. If it's outside your body, you will just chuck it into a bin quite senselessly. But the body does not waste what is in there. So what it does, it picks up all the excess energy and stores it as fat. So you get fat around your skin, fat around your belly, fat around your liver, and over a period of time, all of these excesses will destroy your liver and the body and everything else. So be mindful, ladies and gentlemen, when you eat. Regular exercise. It might be a point of future discussion that if we have gymnasiums only for women, they have it in the West, and it could be wonderful news for our own female folk and partners, because they have only no place to go but other than sit at home until their husbands who've been working hard come down to see them and take care of their families in the evening. Perhaps having a females only gym would encourage our female partners and women to go out there and exercise, and that would be good influence on the children who they spend most of their lives with. So with that said, I'd like to conclude. Thank you again, Sheikh Moiz Buhari and the Luminia Institute for having asked me to come. If there's any questions, we will take it at the end, but I'll now hand this podium over to the gentleman to carry on with Sheikh's talk. Thank you again.
Donate now. Go to thedailyreminder.org/donate.